So hello, I am Marcel Pruga, and for today I will be performing a immediate newborn care. All newborn care should undergo essential newborn care to minimize risk of illness and maximize growth and development. So before anything else, I have already prepared all the necessary materials that I'll be using for this procedure, which is that includes the weighing scale, the towel that I will use for the work of the baby, the eye drop, the vitamin K, thermometer, scissor, the clamp, imagine if this is a clamp, a gloves, sturdy gloves, and a measuring tape, and then the syringe, and also for my documentation. So now we will proceed on hand washing. This is to prevent spreading microorganism and to avoid, to prevent illnesses. So now I already washed my hands, and then I will now proceed on of course, closing the door, the curtains to provide privacy to the patient. And then after that, I will now wear my gloves, with gloves. So here. So I already wear my gloves, so I will now proceed with my patient. So Miss Ma'am, in order to deliver your baby, I want you to push for me, and we'll do a breathing techniques. And in count 1, 2, 3, push. 1, 2, 3, push. 1, 2, 3, push. 1, 2, 3, push. Then I'll get a warm linen. This is for the baby to warm. We will now prepare for the baby. So Miss Ma'am, I want you to push for me once again. So 1, 2, 3, push. 1, 2, 3, push. 1, 2, 3, push. So baby's out. It's a boy. So we have to suction first the mouth of the baby, and then the nose, and then we'll wipe it from the eyes, face, then the trunks, then the body, then legs. So after the baby is dry, we will now put him in the mother's abdomen to promote skin to skin contact. And then after that, we will now also put another dry linen for warmth. And then we will wear the bonnet the baby. This is to prevent hypothermia. So it's already 1 to 3 minutes. We will now proceed on the cutting the umbilical cord. So first I have to palpate the umbilical cord to for position. So there's no pulsating anymore. So I'm gonna grab my clamps and I place it on the 2 centimeter above the base, and then milk him. We want to milk, and then we'll put another clamps 5 centimeter above him, and then after that we will now cut the umbilical cord. Of course, above, near the clamp, not in midway. So here. So we will now so we're done cutting the umbilical cord. So we will now proceed on discarding all the things that we use. First, we have to put it in a chlorine solution for about 10 minutes before discarding it. And after that, we will now proceed on health teaching. Now we will advise our client to maintain skin-to-skin contact with her baby and to position the baby, of course, in prone position. The head should be on one side. So, Miss Ma'am, I want you to watch out for the feeding cues. This may indicate that the baby already want to feed on you. So, Miss Ma'am, the cues includes opening of the mouth, lip licking, sucking, and bringing the fingers inside the mouth, or like moving head as if looking for a nipple, and then fisting of clenching of the fist. Miss Ma'am, if you identify those cues, you may place your baby close to you, nose level, and wait for your baby to open its mouth and latch for your nipple. So after the baby latch on the mother's nipple, we will wait for the full breast completed, and then after that, we will now put an ointment on the baby's eye. Here.
An antibiotic eye drops or ointment are placed in the newborn's eye after birth. This is to protect the babies from getting bacterial eye infection that can occur during birth. Untreated, this infection can cause serious problems including blindness. The antibiotic erythromycin is used most often.
We will now proceed on thoroughly physical examination of the newborn. Abnormality should be reported immediately. So after the physical examination, we will now proceed on injecting the vitamin K to the newborn baby.
At birth, babies have a very little vitamin K stored in their bodies because only small amounts pass to them through the placenta from their mother. So, vitamin K helps the blood to clot and prevents serious bleeding. In newborns, vitamin K injection can prevent a potential fatal bleeding disorder called vitamin K deficiency bleeding, also known as hemorrhagic disease of the newborn.
We will now give animal teaching to the mother. So, Miss Ma'am, it is advised that waiting for the baby should be delayed after 6 hours after the delivery, and also this is to prevent hypothermia, and the baby temperature will be dropped, and this will cause any complication, and this we have to avoid this, and also delaying the bathing of the baby promote the skin-to-skin contact between the two of you. And also, if the baby is want to breastfeed again, just place your nipple, and then it should be nose level. Now, I have here my key forms, so for documentation of the findings, and I have here my sterile gloves for eating. So I already wear my gloves. So I am here now at my client's crib. So we have to check first the name of our client if it's right client. So usually the tag is placed on the crib of the client, and then it's maybe on the wrist or on the ankle. So let's check it first. So it's in place in the ankle of the client, Mr. Born on April 20, 2021. So it's the right client. So we have to uncover the baby to monitor, to assess the vital signs rapidly and efficiently. So the vital signs that I will be performing first is to assess the respiratory rate of the client. So usually the normal respiratory rate is 30 to 60 breaths per minute. So this is to assess also the if the fetal is having fetal distress or respiratory distress. And let's check for nasal clearing. So there's no presence of that, and there's no breathing um, chest
So
retraction.
now we're going to assess the client's breathing. So we're gonna count it for a whole minute. Unlike in adults, which can do it for 30 seconds and multiply it by 2, in babies we have to actually watch the rise and fall in order for us to get it properly, because their breathing varies from the adult. So we're gonna look at the rise and fall of the baby's chest, and we're gonna count it for 1 minute. So the baby's breath is 38 respirations. So after that, we will now proceed on assessing the baby's heart rate. So the normal is 110 to 160 beats per minute. So when a baby cries, it actually varies. We're gonna use a stethoscope and specifically the bell. So we're going to use the apical pulse in order to count the heart rate of the baby. So we're going to locate first the fourth intercostal space from the baby's clavicle. We're gonna go down 1, 2, 3, 4, and we're gonna go lateral and just below the nipple, and we're gonna start listening for a whole minute. So after getting the heart rate of the baby, we will now going to check the baby's temperature using our digital thermometer. The usual is 36.4 to 37.4 degrees Celsius. We're gonna take the auxiliary, so we're just going to turn on the thermometer and we're going to place it in the axillary of the baby, and make sure to put the arm down. So the baby's temperature is 36.8. So now we're going to weigh the baby, assuming that this is a baby scale. We've also removed the infant's clothing. Make sure that the diaper isn't soiled, and we're gonna weigh the baby. So the baby weighs 8 pounds. So after we get the weight of the baby, we will now proceed on getting its height. We will put him back, and then we'll lay him in a flat surface that line in a clean linen, and we're going to mark the ends of the baby from the toes to the baby's head. So we're gonna need a pen, and that measuring tape. So we're gonna hold the baby's head down midline and we're gonna mark that. And then we're also going to hold the baby's one foot down, and we're also going to mark that. So now we're going to mark that. So after marking the ends, we're going to use our measuring tape to measure the length of the baby. The usual length is 18 to 22 inches, and our baby is approximately 19 inches. So after getting the height of the baby, we will now proceed on getting the head circumference. So the normal is 38 centimeters. We're gonna start by lifting the head slightly just for us to put down our measuring tape, and we're going to measure it just above the eyebrow. So our baby's head circumference is 35 centimeter. And now we're going to assess the baby's chest and get the chest circumference also. So we're going to put the tape measure beneath the baby's, and we're going to use the nipple of the baby as a guide. There we go. So the usual chest circumference is 1 to 2 centimeter less than the baby's head. So the baby's head is 35 and this baby's chest circumference is actually 33 centimeters. The baby chest does not have any obvious deformities.
So now we will proceed on the upper scoring. So the A is for the activity, muscle tone. The P is for the pulse rate. And the G for the green base. The A, another A is for the appearance. And the R is for the respiration. So the baby seems...
So now we're going to assist the babies using the after scoring. So we're going to start with the heart rate. So we assessed it earlier. It was 142. It's greater than 100, so it's 2. And the respiratory effort, it is good and strong. That's also a 2. The muscle tone of the baby is active, so he was moving around just now. The reflex irritability or the grimace is crying and vigorous earlier. The color of the baby is pink in the body and blue, a bit bluish on the extremities. So there's presence of acrocyanosis, which is perfectly normal for a newborn like Mr. So overall, the score of the baby is 9, which is within the normal range. So the baby's gestational age is 38 weeks. He is a term baby, and the weight is also assessed earlier. He is 8 pounds, approximately 3,600 grams.
So we're done. I'm gonna disperse this labs first. And then after that, we will now proceed on documentation on the data and findings that we gather. For example, the respiratory rate, the upper scoring, the respiratory rate, temperature, and then abnormalities should be reported immediately to do a prompt intervention. That's all. Thank you.